Hello everyone, I am Dr. Preeti Sharma, pediatrician. Today I will be talking about how to control and manage fever at home for children. Fever is like one of the most common problem all of us encounter, but it's more common in small children and particularly babies after vaccinations, any weather change, any mild viral, or it could be a cause of something more severe like dengue, malaria, flu. But the management of fever remains the same irrespective of the cause of fever. The most basic medicine for fever which most parents have is paracetamol. Please remember it is the first medicine and the only medicine which should be used at home, can be used without consulting a pediatrician also. The dose of paracetamol changes as per the weight of the baby. So I would recommend whenever you go to a pediatrician visit, ask the doctor to write the current dose of paracetamol as per your baby's weight. Another thing to keep in mind is paracetamol comes in different forms. It comes in the form of drops, syrups, double strength syrups. So please check what preparation your pediatrician has written for that particular dose. Paracetamol can be safely given every 6 hours in case of fever. In case of very high fevers, if they are coming back frequently, rarely we advise that it can be given 4 hourly also. Some parents I find are directly using higher fever medicines like mefenamic acid and ibuprofen. That is not recommended. They have their own side effects like gastritis, and mefenamic acid is even known to affect the platelet count. So please don't use them directly. In rare cases where your fever is just not going down with paracetamol, you have given paracetamol, it's 1 hour, fever is still high, then you can use ibuprofen or mefenamic acid as prescribed by your pediatrician. Please don't use these on your own. Now, in the meantime, while these medicines are taking time to act, see, any medicine takes 30 to 45 minutes to show some effect. In the meantime, you have to start sponging the child. Sponging need not be with cold water. You have to use normal room temperature water. If the weather is normal or warm, you can simply take tap water. But in winters, when the tap water is also cold, please add a bit of hot water to make it lukewarm. Do not use cold water. Our aim is to bring the body temperature to normal, not to cause hypothermia, which can be dangerous. Now, a few principles of sponging. You can take 3 to 4 clean cotton cloths. You dip them in water, squeeze them, and then few areas which have to be focused on while sponging is your forehead, your underarms, and the groin area. Rest of the body you can just gently wipe it. These areas keep changing the cloths as and when you feel that the cloth has become warm because of the body heat. Continue sponging effectively for at least 20 minutes. Then you can recheck the temperature. If the temperature is coming down, you can stop sponging. Else you continue till the temperature starts falling or at least reaches around less than 101. During fever, another thing to keep in mind is to keep the child well hydrated. See, most children in most of the sicknesses, be it fever, cough, cold, loose motions, their diet tends to go down. But in fever, because of the high temperature, they need more fluids. By fluids, I don't mean just plain water. You can give them some lemonade, coconut water, buttermilk, some soups, dal water, chicken soup. Give them lots of liquids to keep up their energy levels. In case fever does not start decreasing even after using your paracetamol or sponging, then please rush to the nearby emergency. Hope this helps the next time your child has fever.